going to be as brief as a skirt. So Nakasero Hospital has a critical care unit, which is the best ICU in the country. I'm proud to say that, as you're going to see. So team introductions, like I said, Dr. Nakasero Ogedele is our psych lead. And the data entrance, we have Naso Zeruth, myself. We have Serada Henry over there. Then Babazi Julius, he's also there. And Nabatanzi Fahima. We've been working with this team since we joined the ICRU, and we've been really working together on all the projects so far. So about our critical care unit location, we are located on the first floor of the Western Wing, because when you look at our hospital, we have the Eastern Wing and the Western Wing. So we are on the first floor, Western Wing, and we have a bed capacity of 12 beds, which are fully ICU. So we are able to admit 12 ICU patients, because they are all well equipped. Our coverage, we are always covered by an intensivist, both for day and night shifts. These work hand in hand with the residents, one during day and one in the night. So you see, when you come to our ICU, you're in safe hands. They're always there. It's open 24 hours. And our staffing is also good. I work with a team of 57 critical care nurses. I have 6 nursing assistants. I have 2 receptionists. I have 2 billing officers. We have 2 customer care. That we're also self-contained. They're like critical care based, not hospital based. So our staffing is really good, and that is how we work. So as you can see, that is our ICU. And in the ICU side, we have 7 ICU beds. We have an isolation room. It is captured here, if you can see, it's in that cubicle. And then also the HDU side, there are 4 beds. So 7 ICU, 1 isolation room, and then 4 HDU beds to make a total of 12, but they're all ICU capacity. So ICRU, we joined ICRU in July 2024. We started with Motivate, which we did successfully, then moved on to ProFluid, and now went to ICOP. We're still continuing with the registry. Experience working with it, we're able to form new relationships as we're all here. I've formed new friends, and this has been continuous, because wherever you go, at least there is networking, which is really good, and that has helped us a lot, professional-wise and personal-wise. And then the second is we've gained exposure to different aspects of life. We've looked at different perspectives, how people do their things in their ICUs, and we've been able to copy and transfer some of them to our ICU to make it better. Then we've also improved on our technology and the knowledge that we use to work on clients. Then also the motivation, data entrance here, we all know we are beneficiaries of the project. So that is also an important thing. And then it has also motivated us to work for better patient outcomes. Like, you have that love to do better such that your data improves. You see, you were at a hospital acquired infections of 20% and you want to see it go down to 1%. So you work harder to achieve that. Then we were also to establish a register. Originally, we had a data set, but it wasn't capturing the data that we are capturing with the register. So on the establishment of the register, we are able to gain data, which we use to benchmark and compare patient outcomes between different units, different ICUs, and also how we were and how we are. Then it's also used as a quality improvement tool to see what we can improve as we analyze our data and do the continuous improvement plans. And we have been able to create protocols, different protocols, ICU protocols, to help in the service delivery to our patients. So we are glad we joined the ICRU. As you can see, one of our nurses taking care of a patient. Thank you so much.